and related measure of the virus's damage: hospitalizations. Now, as you watch this, remember, after someone is exposed, it typically takes about 4 weeks before they might become sick enough to require hospitalization. June 20th, Tulsa, Oklahoma. An indoor rally. Here was the situation going into that weekend in Tulsa. On that particular day, there were 197 hospitalizations in the state. On July 8th, 2.5 weeks later, the Tulsa Department of Health held a press conference.
Past 2 days, we've had almost 500 cases, and we knew we had several large events a little over 2 weeks ago, which is about right. So I guess we just connected out.
And then 5 weeks after the rally, the number of hospitalizations is at 625, more than triple what it was on June 20th. June 23rd, Phoenix, Arizona. Just days after that stop in Tulsa, President Trump held another indoor event, this time Phoenix. When he visited, around 2,000 people were being hospitalized daily in Arizona, though the number was already rising. Fast forward 10 days, and that number shoots up to more than 3,000 cases daily, and that's maintained over the next 3 weeks. August 17th, Oshkosh, Wisconsin. Take a look at what happened after the president visited Oshkosh on August 17th, this time outside. 5 weeks later, the number of hospitalizations rising by nearly 20% and continues its upward climb. Now, as far as the recent rallies go, Florida, Pennsylvania, and Iowa, well, they've all been within the last few weeks, so we may not have seen the impact on hospitalizations as of yet.
There's no doubt that there has been transmission at the protests, the political rallies. It's just a fact that the virus doesn't discriminate. It will find a new host in a crowd that's there. If you're gathering together in a large group of people, there has almost certainly been transmission. It is impossible, very difficult to visualize that transmission or document that transmission when there are so many people attending these events and then they scatter back out into their communities.
On Saturday, the president's heading to Janesville, Wisconsin, about an hour away from where this 530-bed field hospital was erected earlier this week, a foreshadowing of what may be to come.
Sanjay joins me now. I also want to bring in Dr. Chris Murray, the director of the Institute for Health Metrics and Evaluation at the University of Washington. His institute's computer modeling has often been cited, and he's been a mainstay of our broadcast, helping explain what may lie ahead. Sanjay, considering how many rallies and events there are like this, why haven't we heard of more cases than connected to them?
Well, it's just very hard to do the contact tracing here, Anderson. As you know, I mean, we've talked about this. You get 50,000 newly infected diagnosed people in any given day. I mean, it's an entire sector of society really to do that much contact tracing. People may not want to participate. It's just very challenging. And you know, I don't think we're giving it a lot of focus in this country, in part because of those numbers. To give you some context, in New Zealand, the contact tracing there is so sophisticated. There was a report recently in one of the medical journals about the fact that they were able to contact trace people getting infected from a particular garbage can lid. They were actually showing this garbage can lid as a potential source of infection. They were using CCTV cameras, tracing people's whereabouts, and coming to that sort of conclusion. That's how sophisticated you can get. We're obviously nowhere close to that here, Anderson.
Dr. Murray, at an indoor event to protect seniors in Fort Myers, Florida today, the president said that we are, quote, rounding the turn and will be soon ending the pandemic. Can you just talk about what your most recent model finds in terms of deaths in the U.S. I mean, are we rounding a turn?
No, Anderson, we're not rounding the turn. If you look at the map in the U.S., what's happening is exactly what we expected. Is the whole northern half of the U.S. transmission is on the upswing. You look across all the northern countries in Europe, they're already well into the fall winter surge, and that's what's heading our way. We expect that the death toll, unfortunately, unless we change our behavior, is going to reach 390,000 deaths by February 1st.
That's almost double what it is now.
Absolutely, yeah. It's not over. The worst is still to come, unfortunately.
I mean, that's extraordinary that from between now and February 1st, as another almost 200,000 people, according to the model, will die.
Absolutely, and we're going to, see these upticks just gradually get or steadily get worse and worse as we roll into November and December. And I think it's at that point that it's not just people are going to die, but many states are going to have to put back on some of those mandates if they want to keep the hospitals from being overwhelmed. And then there's all the economic hit that comes with that as well.
And just to be clear, because you and I talked about this before, if right now, I think you said around 45% of the country wears masks regularly, if 95% of the country wore masks regularly, the number of deaths could be cut by some 40,000, if I'm not wrong. Is that correct still?
No, the number of deaths, it could be cut quite a bit more. It's more, in our latest estimates from this week, we could cut deaths between now and February 1st by increased mask use by 74,000. So it's a really big number.
Wow.
And the future is not cast in stone. It's really in our control in terms of whether we're careful and wear a mask,
Right.
what's going to happen in each state.
And Sanjay, to the point that Dr. Murray also just made, which is, I think is really important to talk about, if people were wearing masks now and distancing, then the shutdowns that Dr. Murray says are probably inevitable in some states because of the numbers will rise so much. Those shutdowns could actually might not take place if more people wore masks now, so they wouldn't reach the levels of deaths that we're talking about.
That's right. I mean, even if you look at the CDC model and sort of, dive deeper into those numbers, wearing masks, the physical distancing, the hand hygiene, all the things that we've been talking about, you could start to see the bending of the curve. I mean, it varies when I looked at those models in terms of how long that would take. But yeah, I mean, if there was sort of widely adopted, sort of application of those basic models, 5 weeks or so, I think you could really start to see the curve start to flatten and then bend downward.
Yeah. Sanjay, I knew you had a question.
And I'm curious as well, if I can ask for a second. Yeah, Dr. Murray, so I look at these numbers very carefully. And so the last model, as you mentioned, 390,000 people projected, sadly, to die by February 1st. It's actually down a little bit, 6,000, I think, from what you had projected or what the model had projected earlier. And yet we know the virus was likely to spread more during this period as well, according to the model. So more spread, and yet the death rate came down a little bit. And I'm just curious, I know it's a small amount of change, but why would that be?
Well, it's mostly California, and what's happening in California is that deaths have been coming down really pretty steadily. And even though cases are now slowing and are actually sort of flattening out in California, we're still seeing deaths come down faster than we sort of expected to see. So that change in our numbers is really driven by California, and the uptick all across the northern states is sort of exactly as we predicted. So no change there.
Dr. Chris Murray, appreciate it. Sanjay as well. Thank you so much. Still to